morning, everyone. Good morning, you all. This is Dr. Lynn Daniel, PhD, EDS. I am the self-care evangelist. I educate, inspire, and engage you in discussions about self-care. What is it? Why it's important? And how it can be implemented. You know, it takes more than just you to be well. All right. So today I want to come and share with you a study that I came across in my informal research on this topic. I was really intrigued by this particular study called the Organizational Best Practices Supporting Mental Health in the Workplace. This is a study conducted by, here are my notes, Wu, Romer, Kent, Ballard, and Getzel. The study was published in December of 2021 in the Journal of Environmental, Organizational and Environmental Medicine. I think I said that correctly. And if not, I'll have it somewhere on these slides so that you can hunt this study down and read it for yourself. Okay. Let's begin. I'm going to start off by sharing some of my background so that you can know, well, why should I listen to this lady? Who is she? So again, I am Lynn Daniel, PhD, EDS. I earned my PhD from Concordia University in reading, language, literacy, and leadership. I successfully defended my study on the topic of teachers' attitudes about teaching adolescent refugee students. Okay. You see the icons showing organizations that I am engaged with or I have been engaged with in the past. These are educational organizations, institutions, training places where I earn degrees, and where I am currently engaging in dialogue and work to support training for teachers of refugee students. All right, let's begin. So, what is the objective like? Why am I sharing this information with you all? So, my purpose for sharing this information is to increase your awareness and to engage you in discussions on the topic of self-care. Like self-care, when you go back and look at the International Self-Care Foundation's 7 pillars, they also have a matrix, and I need to find that matrix and share it with you all because that matrix shows that yes, there is an individual level, but there are 2 other levels to the matrix of self-care. And it involves the community, it involves the organizations. There is a global perspective around the topic of self-care. So I am here to increase your awareness on the importance of this topic and how you can incorporate strategies into your life. Okay, so this study by Wu et al. Was designed to provide a narrative review of best and promising practices in the workplace, to identify criteria and research-based evidence to back up the criteria that they would use to select a winner for the newly developed Carolyn C. Mattingly Award for Mental Health in the Workplace. So this is a relatively new award. I was reading where the first winner, the 2021 winner, is a journalist by the name of Christina Caron or Caron, Caron. She is a New York Times reporter, and she won this award for reporting on mental health issues related to teen suicide in Black teens. Okay, so Wu et al. Conducted this literature review. That's the process that they use to come up with this evidence-based criteria to support the nomination of candidates for this award. And their findings, so what this literature review helped this study team to find and to discover, they said that the fear that employees face if they feel like they especially during the pandemic of 2019, 2020, the COVID-19 pandemic, heightened emotional distress because of fears attached to the pandemic, fears related to catching diseases, spreading diseases, having highly ambiguous information being disseminated, uncertainty, social isolation, and all of these things compounded on the job, especially as jobs pivoted to remote, virtual, and new methods and modalities of working. Now, even though employees were feeling overwhelmed and highly stressed, there was stigma attached to why employees did not articulate their concerns with their employers. They didn't want to be stigmatized. I'm going to go back one slide. These are the okay. Let's get to where I'm looking to go. Here we are. These are the 8 categories of the best and promising mental health practices in the workplace that Wu and et al. Identified. Okay. And this slide here is what Wu and et al. They were able to determine that as a result of the pandemic, many employees had poor mental health, but they did not want to report on themselves because they didn't want to be stigmatized, isolated. They didn't want to have negative consequences, especially because most employees are aware that there are negative connotations attached to mental health, and especially when you have declining mental health or you're going through some mental health crisis. And so they're silent. They were being silent. One that also determined that the direct and indirect cost of absenteeism, which is an indicator of mental health crisis, employees not showing up to work, that was costing $1.7 trillion annually in 2010. So this is even prior to the pandemic. So you can imagine that $1.7 trillion of losses had compounded by 2020. Presenteeism incorporates this new silent quitting trend that we're hearing a lot about, where you're going to work but you're not productive, you're not working, you're just there getting paid. And so absenteeism and presenteeism are costing employers almost $3 trillion annually, with that number expected to double by 2030. It's an expensive problem to have. So why did Wu et al. Even take on this literature review to look for the best and promising workplace practices to address mental health? Well, in 2016, Johns Hopkins Bloomberg School of Public Health hosted a public health summit titled Mental Health in the Workplace, and representatives from various professional disciplines attended this summit and concluded that a collective call to action was necessary to advance workplace mental health. And so In response to this consortium, Wu and et al. Developed or conducted this literature review to develop a scorecard, if you will, a quantitative scorecard, um, to use as a way to measure mental health in the workplace, to shape workplace culture, to hopefully increase the value of addressing mental health in the workplace and well-being in the workplace, and to enhance the dissemination and accessibility of workplace mental health information, and finally to establish an award to recognize exemplary programs that address workplace wellness and mental health concerns. So, this study, the literature review, I'm encouraging you all to read it. I encourage you to Google Wu et al. Google the title and find it. This is is comprehensive and I think is very meaningful to the organizational level, to the individual level. It's, I think, an important read. Let's move on. The goal, I think I shared this. The goal is to encourage employers to take the topic seriously, to detach stigma from the topic of mental health, wellness, and to support the best practices to promote wellness, to help their employees develop the culture that embraces mental health wellness on the organizational level. And I'm going to touch on, so I am going to touch on these 8. So let me see if I can't go back to that slide. Hold on. Let me go back to the slide with the 8 criteria. And then I am going to, let's see if this is the slide. Getting there. Thank you for your patience. Here we are. Okay, so these are the 8 criteria for the Carolyn C. Mattingly Award that Wu and et al. Were able to disseminate from their literature review. So this is how they define culture. These definitions, I think, are imperative because they help us to have a common language, a common vocabulary in our discussion. So culture is positive organizational culture that supports employees' mental health by building mental health into the organization's human capital strategy, governance, and leadership emphasis on employee psychological well-being, including mental health and organizational communications, materials, vocabulary, verbiage is addressed, supported. That is culture. Robust mental health benefits looks at the health plan that provides affordable access to a broad range of mental health services and provides accessibility to, it considers the quality of the care. Not only does the benefit afford you accessibility, but it's meaningful and you can afford it. Okay. And the quality of the care is high quality and it's adequate and it's reasonable. Okay. Employer sponsored mental health resources includes the utilization of stress management practices that provide employee resources, address organizational issues that cause stress, and reduce physical and psychological stressors in the workplace environment. That's workplace policies and practices. Healthy work environment is Opportunities to mentally recharge, quiet rooms. And I was looking at my campus where I currently teach, and I was like, do we have a quiet room? We do have, what do we call those? Collaboration rooms. So I go in that collaboration room almost daily, and it is a quiet place when I'm there. At other times, I see teachers in there eating lunch and sharing that space for lunch. But it's good to have a place where, if your classroom is unavailable, or if you just want to leave your domain where you function most of the time when you're there at work, it's so great to have a quiet place. So I appreciate them identify the quiet rooms. Promoting effective use of breaks and time off. Having an infrastructure that supports healthy behaviors and self-care, like healthy food options, fitness facilities, open stairwells. Opportunities for social connectedness and inclusion, social gathering, employee support groups, volunteer opportunities. That is healthy work environment. Leadership support, leadership training on mental health awareness, sensitivity, and providing support to employees. Crisis management training and protocols to respond to workplace violence and or suicides, modeling healthy behaviors, leaders including mental health topics in communications, managers participating in workplace programs, using supportive supervision techniques such as providing effective performance feedback, managing conflict, managing work and job related factors that can affect mental health, such as autonomy and control, monitoring, overworked, setting clear performance expectations. This is leadership support. Positive outcomes includes increased awareness, utilization, and satisfaction with mental health programs and resources, improved employee mental health and well-being outcomes, reduction in stigma related to mental health. That is positive outcomes. And innovations, incorporation of technology or non-traditional programs and services that yield positive mental health outcomes, the removal of barriers making resources easily available, and creative communication strategies. That is innovation. These are the findings from this literature review by Wu et al. And I think this report, this article, this lit review is dynamic. I think it is imperative to read. I really like the fact that they established, Wu et al. Didn't establish the award, but they helped to identify the criteria to support choosing a winner or a candidate to win the award. And I think that workplace recognition for best practices in mental health is something that uh, uh, organizations may aspire to. They may aspire to be awarded, to be nominated, to have this plaque or this recognition aligned with their name and with their vision. I think it's a great thing. And the outcome, of course, is to incentivize the organizations to improve. And so the conclusion, promote positive mental health in the workplace. They recognize that it is a complex problem. They understand that you need to address the larger culture if you want to see change and improvement. And promoting it requires collaboration on multi levels. So I want to thank you all for participating today, engaging in this review of a literature review by Wu and et al. I hope that you found value in this presentation, please share it with your communities, with your connections, and continue to engage with me in the discussion of self-care and wellness. Here on LinkedIn, I'm also on YouTube. I'm Lynn Daniel on YouTube. I have a Facebook group called the Doctoral Aftercare and Healing Group for doctorates and doctoral candidates. So find your community and plug in. All right, you all. Thank you so much. Be blessed.